Hi, my name is Joshua, and I'm going to be your student nurse today. So I'm going to wash my hands before we begin. So I'm going to ask you to state your name and your date of birth for me, please, just so I can verify that it's you. Okay, great. So what we're going to do today is that we're going to have a doctor-ordered NG feeding tube. So that's a nasogastric tube that's going to go through your nose, to the back of your throat, and down to your stomach. And essentially, it's going to provide direct nutrients to your stomach. So before we begin today, I'm just going to lift your bed up to a working height, and I'm going to lift your head to a 90-degree angle. This 90-degree angle is going to help the tube go down smoothly and to ensure that it gets to your stomach without any further complications. Okay, and before we begin, is there any kind of allergies, past medications, present medications, or past surgeries that I need to be aware of before we begin this procedure? No? Great, okay. So what I'm going to do first is I'm going to put some gloves on, and I'm going to explain some of the things I'm going to be using. So I'm going to be having a blue pad, and that's going to be on your chest, and essentially it's just going to be a pad that's going to catch any kind of fluid that might come out during the procedure. And then there's also going to be a basin that I'm going to place down on your legs, and essentially if you feel the need to gag or cough in any way, you can grab that basin to help limit the kind of fluid that can come out on you, okay? So what I'm going to be doing is I'm going to be taking this NG tube. I'm going to measure to find the link to your stomach. So what I'm going to measure is I'm going to measure it from the tip of your nose to the tip of your ear and then down to the tip of your sternum. This is just going to help ensure that the tube reaches your stomach and so that I know about the place to stop, the top inserting it. Okay, so I'm going to measure from the tip of your nose to the tip of your ear. And I'm going to go from the tip of your ear down to your sternum. Okay, so I have an accurate place of where your stomach's going to be. So I'm going to put a piece of tape to mark it. Okay, so what I'm going to do now is I'm going to lubricate the end of the tube 2 to 4 inches in the packet so that it goes down as smoothly as possible. Okay, so before I begin, I'm going to ask you to lift your head back. That's going to help the tube go through your nose and down to the back of your throat. So I'm going to push on your right nostril and ask you to blow. I'm going to push on your left nostril and ask you to blow. Which nostril did you blow out best? Your right nostril? Okay, so that's the nostril I'm going to put it in because that's the least obscure nostril. Okay, so tilt your head back. I'm going to start inserting it. This may be uncomfortable, but I'm going to ask you to bear down because I'm going to try to get through it as quickly as I can. And if you feel any kind of pain or discomfort, that's fine. Just tell me and we can stop the procedure immediately and we can try again later. Okay, so we reached the end of your or top of your throat. So I'm going to ask you to do now, I'm going to ask you to tilt your head down, and that will help the tube go down from your throat to your stomach easier. And on the count of 3, I'm going to ask you to take a swallow. And when you swallow, that's when I'm going to push the tube. And then we're going to do that about 3 times, okay? So on 1, 2, 3, swallow. You're doing great. 1, 2, 3, swallow. And one more time. 1, 2, 3, swallow. Okay, so we've reached the mark on the tube that indicates where your stomach is. So I'm going to take this piece of tape. I'm going to tape it to your nose and attach it to the tube to secure the placement during the x-ray. Okay. So now I'm going to send you off to an x-ray to secure the placement of the, or to ensure the placement of the tube. Okay, so we come back from the x-ray, and the x-ray says that the tube is in your stomach. So what we're going to do now is I'm going to remove that temporary piece of tape and instead put a little more permanent piece of tape to make sure the tube is secured during the time that we have to keep it in. I'm going to put some new gloves on. Okay, so I have a new piece of tape right here. And this is going to be the slightly more permanent piece of tape. So I'm going to remove the temporary and slide it down a little bit, keeping your tube in place. I'm going to put this piece of tape right here on your nose. I'm going to secure it to the NG tube. Okay. So now we secure the NG tube. You're gonna take the metal wire that's inside the tube outside, and that was just used to help secure the placement of the tube in your stomach. You're gonna take that out. And now I'm gonna attach your feeding tube up to the feeding pump, and that's gonna have a continuous flow of nutrients into your stomach. Okay. I'm gonna come back later when the doctor orders the removal of the NG tube, and we're gonna remove the NG tube and hopefully start you on more liquid and solid diets. Okay, so I'm back, and the doctor has ordered an NG tube removal. So what we're gonna do is I'm going to remove the tape and ask you to hold your breath as I slowly remove the tube from your stomach. Now this will be uncomfortable, but I'm gonna ask you to bear with it. And if you feel any kind of pain or any kind of that, we can stop immediately and try again in a little bit, okay? So I'm gonna ask you to hold your breath. And on the count of 3, I'm gonna pull it out, okay? 1, 2, 3. Okay, can you catch your breath? I'm gonna ask you to hold your breath in 1, 2, 3. Okay, one more time. 1, 2, 3. Okay, so we've removed the NG tube. So now I'm just gonna get rid of these materials, and hopefully we can start you on a solid diet.